What if your favorite fruit, yes, the one you've eaten since childhood, was quietly increasing your risk of stroke while you sleep? No pain, no symptoms. You go to bed feeling perfectly fine and wake up unable to move your arm, slurring your words, or worse. And the most shocking part, it's not junk food, alcohol, or smoking. It's fruit, something you thought was helping you stay healthy. Hi, I'm Dr. Nana. I've spent decades studying how aging affects the brain, and today, I want to share something that might surprise you. I've seen too many seniors, people just like you, fall victim to stroke not because of fried food or bad habits, but because their bodies change with age, and no one warned them about how even healthy foods can become risky. You see, after 60, your kidneys, liver, and blood vessels don't process sugar, potassium, or acid the same way. Medications, slower circulation, and dehydration at night create the perfect conditions for trouble even from something as innocent as a fruit. That's why today on Senior Health Boost, I want to walk with you through 6 common fruits that may quietly be doing more harm than good, especially when eaten at the wrong time or in the wrong combination. This isn't to scare you, it's to protect you, with real, science-backed insights that could keep your brain and heart safe. And if you're someone who appreciates honest health advice rooted in science, not hype, please subscribe to Senior Health Boost and drop a yes in the comments if this topic hits close to home. Let's begin with one of the most beloved fruits in America, a snack we've trusted since childhood: bananas. They're soft, sweet, easy on the stomach. They seem so safe, right? But if you're over 60, eating bananas, especially overripe ones, might not be as harmless as you think. Here's the reason. As bananas ripen, the starch turns into sugar. That's why they taste sweeter the longer they sit on your counter. But while that ripeness improves flavor, it also changes how your body reacts to them. An overripe banana has a very high glycemic index. It floods your bloodstream with sugar fast. And for seniors, that sudden spike is a serious concern. Why? Because after 60, your insulin sensitivity declines, your kidneys slow down, and your blood vessels get stiffer. Managing sugar and potassium becomes more difficult. So that speckled banana, mushy and sweet, might actually spike your blood sugar, raise your blood pressure, and even disrupt your heart rhythm. Let me tell you about Margaret, a 76-year-old retired librarian from Illinois. Every morning, she'd slice 1 or 2 overripe bananas into her smoothie. She thought it was the perfect, healthy start to her day. But one morning, Margaret woke up feeling dizzy. Her speech was slurred. Her husband rushed her to the ER. The diagnosis? A mild ischemic stroke. Her blood pressure had surged overnight, and her potassium levels were unusually high. The doctors explained that the combination of sugar, potassium, and morning dehydration had quietly worked against her. Margaret didn't stop eating bananas, but she made one simple change. She switched to firmer, greener bananas, and made sure to drink water and eat some protein first thing in the morning. Within weeks, her energy returned and her blood pressure stabilized. The takeaway here isn't to fear bananas, but to respect how your body changes. Overripe bananas, especially in large amounts or eaten alone on an empty stomach, can silently increase stroke risk in seniors. But bananas aren't the only fruit hiding this risk. Next, let's talk about another favorite. Tiny, sweet, and often tossed into lunchboxes or fruit salads: grapes. They may look innocent, but there's more going on beneath that smooth skin. Previously, we talked about how something as familiar as a banana, especially when overripe, could quietly increase your risk of stroke after 60. But bananas aren't the only fruit that can cause unexpected harm. Now, let's talk about another seemingly innocent snack: grapes. Grapes. They're tiny, sweet, refreshing, easy to eat by the handful. But just like bananas, grapes can be deceiving. You won't feel it at first. No pain. No warning signs. But the risk builds day after day until one morning, something feels off. Maybe your hand trembles while pouring your coffee. Maybe your words just won't come out right. And by the time you notice, it could already be too late. That's exactly what happened to Mrs. Evelyn Morris, a 79-year-old retired music teacher from Colorado. Sharp-minded, full of life, and fiercely independent, Evelyn had a daily ritual. Every mid-morning, she'd sit in her sunroom with a book and a generous bowl of red grapes. She believed it was a healthy habit: fruit instead of cookies or crackers. Some days, she'd go through 2 cups of grapes without a second thought. It felt light, clean, and satisfying. Then one afternoon, while writing a birthday card to her grandson, She noticed her handwriting wasn't quite right. Her hand trembled. Then she paused, because she couldn't remember how to spell congratulations. The word one she'd written 100 times just vanished from her mind. Alarmed, her daughter rushed her to the emergency room. After several tests, the doctors confirmed she had experienced a transient ischemic attack, or mini-stroke. It was brief, but it was a warning shot, a reminder that her brain was under stress. Her lab work told the full story: high blood sugar, low-grade inflammation, and pre-diabetic markers she had never been aware of. Evelyn was stunned. She ate clean. She walked every morning. She avoided junk food. So how did this happen? The answer: even healthy habits, when not timed or balanced properly, can become harmful with age. I'm Dr. Nana, and here's what I now tell every patient over 60 who asks about grapes. Never eat grapes on an empty stomach. Why? Because grapes are essentially sugar in disguise. A small fruit, packed with glucose and fructose, especially the extra sweet seedless varieties found in most supermarkets. When you eat a handful on an empty stomach, that sugar rushes straight into your bloodstream, fast. And as we age, our insulin response slows down. Our blood vessels become more delicate. That sudden spike doesn't just give you energy, it creates inflammation. Inside your body, that means swelling in tiny capillaries, microscopic damage. And your body responds by trying to repair it with tiny blood clots. These clots may be small at first, but over time, they can travel, they can lodge, and that's when trouble begins. Second tip: don't eat grapes by the bowl. It's easy to snack mindlessly on fruit, especially while watching TV or reading. But 2 cups of grapes can contain more sugar than a can of soda. And unlike processed sugar, the fruit sugar comes with the illusion of being healthy. That illusion can be dangerous. Third tip: always pair grapes with protein or healthy fat. A few almonds, a slice of cheese, even a spoonful of plain Greek yogurt. Why? Because protein and fat slow down how quickly sugar hits your bloodstream. It helps your body absorb nutrients in a more balanced way and reduces the spike that triggers inflammation. And here's one more piece of advice that surprises many of my patients: avoid grapes at night. Your body needs stability while you sleep. Blood flow, heart rate, oxygen all need to be steady. A spike in sugar right before bed can interfere with that. And if you're taking medication for blood pressure or diabetes, grapes can quietly magnify the effects, causing sudden changes in pressure or blood sugar that you won't even feel until it's too late. So, while grapes aren't inherently dangerous, they require respect. Don't let their size and sweetness fool you. In the right amount, at the right time, they're a pleasant treat. But if you eat too many, too often, or at the wrong time, they can quietly stack the odds against your heart and brain. Now, if grapes surprised you, just wait until we talk about pineapple. That sweet tropical bite you might enjoy after dinner? It could be interfering with your brain while you sleep. Let me explain why. Pineapple might seem like the perfect dessert. It's juicy, vibrant, refreshing. But for older adults, especially those taking medications or managing circulation issues, pineapple can create a dangerous mix of complications. You see, pineapple contains a natural enzyme called bromelain. In small amounts, it can aid digestion and help break down protein. Sounds helpful, right? But here's the catch. Bromelain doesn't just work in your digestive system. It can also affect your blood's ability to clot. And when combined with blood thinners or medications that already influence platelet activity, it can thin your blood too much. That opens the door to a serious complication: brain bleeds. A type of stroke far more dangerous than ischemic strokes. Harder to detect early, harder to recover from. But bromelain isn't the only issue. Pineapple is also extremely high in natural sugar and has a high glycemic index. This means it pushes sugar into your bloodstream very quickly, especially if you eat it alone, or right after dinner, when your metabolism slows down for the night. Now imagine this. You've had a lovely dinner, then a few sweet slices of pineapple. Your body isn't burning energy anymore. You're winding down, preparing for bed. That sugar doesn't get used, it sits in your bloodstream, circulating and stressing your vessels. Then there's the acid. Pineapple is one of the most acidic fruits in the grocery store. For older adults, that acid can silently trigger nighttime reflux even if you don't feel the burn. Here's what many people don't realize. That reflux can send small amounts of stomach acid up your throat and into your airway while you sleep. You might not even cough or wake up, but that acid lowers oxygen levels in your bloodstream, just enough to stress the brain. And that's exactly the kind of silent stress that has been linked to early morning strokes, the ones that hit hardest, when the brain is least prepared to recover. Let me tell you about Mrs. Clara Hughes. She's 77, a retired choir director from North Carolina. Health conscious, energetic, and thoughtful about her diet. Instead of cakes or cookies, Clara treated herself to pineapple slices after dinner. It felt like the smarter choice. But one morning, she woke up dizzy. She couldn't walk in a straight line. Her daughter noticed her speech sounded off, slurred and slow. They rushed to the hospital. The scans revealed a posterior stroke, a type that affects balance and memory. Her blood sugar was elevated. Her platelet levels were inconsistent. And further testing showed evidence of oxygen deprivation during sleep, likely caused by nighttime reflux. In Clara's case, it wasn't one single issue. It was the combination. The sugar, the acid, the bromelain, all from the fruit she thought was helping her. So, here's my advice as Dr. Nana. Enjoy pineapple in small portions only. Eat it earlier in the day, when your metabolism is active. Never eat it on an empty stomach. And always check with your doctor if you're on blood-thinning medication. This doesn't mean you can never enjoy sweet fruits again. It means you need to understand how your body changes with age and how even healthy choices can have unexpected consequences when they're not tailored to those changes. And remember, it's not about fear, it's about awareness. Coming up next, we'll look at a fruit that's often recommended for digestion, but can actually backfire in seniors when eaten too close to bedtime. It's one that might already be in your evening snack routine. And like pineapple, it might be quietly changing your brain chemistry overnight. Ready to find out what it is? Let's keep going. In the last section, we uncovered how pineapple, sweet and tropical, can quietly create a storm of sugar, acid, and clotting risk in seniors, especially when eaten after dinner. But if you thought that was surprising, get ready for the next one. Because the fruit we often think of as the ultimate hydrator may actually be dehydrating your brain. Yes, watermelon. It's the summer classic. Cold, crisp, and juicy. On the surface, it seems like the perfect snack, especially when you're trying to stay hydrated. After all, it's 90% water, right? But for older adults, watermelon carries a hidden twist. And the problem isn't the water, it's how your body reacts to it. You see, watermelon is a natural diuretic. That means it encourages your kidneys to produce more urine. Normally, that might not be a big deal. But if you're already taking diuretics or blood pressure medications, which many seniors are, it can cause you to lose too much fluid. Now think about this. You've had your meds in the evening. Dinner's done. You're relaxing and decide to enjoy a few slices of watermelon. You're trying to stay hydrated before bed. But what actually happens is that the fruit pulls water out of your system, just as your body is winding down for rest. Then, while you're sleeping, you continue to lose fluids without even knowing it. You're not drinking. You're not sweating. But your body is still filtering fluids through your kidneys. And when that fluid level drops to low, your blood gets thicker. Thick blood flows slower, more like syrup than water. And in narrower, aging arteries, that slow, sticky blood can begin to form clots. Combine that with the naturally lower blood pressure we all experience at night, and you've got a risky mix. This is the exact situation that happened to Mr. Howard Lynn, 82 years old, a retired postal worker from Indiana. Howard was doing nearly everything right. He walked daily, watched his sugar intake, took his medications on time. But each night, especially during warmer months, he'd enjoy 2 or 3 large slices of chilled watermelon. It was his treat. It helped him cool down and made him feel like he was caring for his health. Then, one morning, Howard woke up feeling strange, lightheaded, off balance. When he stood up, his knees buckled and he collapsed. His wife called 911. At the doctors found his blood pressure dangerously low. His blood work revealed signs of dehydration and thickened blood plasma. A scan confirmed he had suffered a small ischemic stroke, likely caused by a clot forming overnight. Howard was stunned. How could something as clean and refreshing as watermelon be the culprit? But when the doctors looked at his evening routine, including diuretic medication and large portions of watermelon, it all added up. His body was simply losing more fluid than it could keep. So what's the key takeaway here? I'm Dr. Nana, and I always remind my patients, enjoy watermelon earlier in the day, not at night. Eat it in moderation, not in massive servings. If you're taking water pills or blood pressure meds, talk to your doctor before making watermelon a daily habit. And don't just rely on the fruit alone for hydration, pair it with electrolytes. That can be a pinch of salt, a sip of coconut water, or a few bites of food that help your body retain fluid. And please pay attention to the signs. If you're waking up with dry mouth, dizziness, or feeling off balance before breakfast, don't brush it off. Those aren't just aging symptoms. They could be your body whispering that something's out of balance. Now, watermelon might not have been on your radar as a potential risk, but it's not alone. Let's talk about a fruit that's practically synonymous with health and immunity. One that shows up on breakfast tables, in holiday gift baskets, and has long been considered a staple of heart-friendly nutrition: oranges. That's right, oranges, and especially orange juice. A glass of OJ with breakfast. A peeled orange in your lunch. Maybe even a fresh one tucked into your Christmas stocking by your grandkids. It feels wholesome, nostalgic, safe. But here's what most seniors have never been told: oranges can interfere with your medications. And the danger isn't just about the sugar. Yes, one glass of orange juice can spike your blood sugar quickly, especially if you're drinking it alone or on an empty stomach. But the bigger concern lies in a natural compound found in citrus fruits like oranges, grapefruits, and even Seville oranges. It's called furanocoumarin. That might sound like a word from a chemistry textbook, but its effect is simple and serious. Furanocoumarin blocks enzymes in your liver, specifically the ones responsible for breaking down many common medications. When that happens, your body can't process your medication properly. That means one of two things might occur. 1. Your body absorbs too much of the drug, making it too strong, even if you're taking your regular dose. 2. Or it doesn't absorb enough so the drug doesn't work at all. Neither outcome is good. Imagine you've been on a blood pressure pill for years. It's been working fine, and suddenly, with no change in dose, your pressure drops to low. You feel faint, dizzy, or worse, you pass out. That's not just a medication issue, it could be your orange juice quietly interfering. Now, this doesn't mean you can never have citrus again, but it does mean that you need to know which fruits interact with which drugs and make smart choices based on your personal health profile. I often tell my patients at Senior Health Boost, if you're on statins, calcium channel blockers, or blood thinners, check with your doctor or pharmacist before making citrus fruits, especially orange juice or grapefruit, a regular part of your diet. And one more note, juice is not the same as whole fruit. When you juice an orange, you're removing fiber and concentrating the sugar and compounds. That glass may feel refreshing, but it hits your system faster and harder than a peeled orange ever could. So if you're going to enjoy oranges, do it wisely. Eat whole oranges, not juice, to slow sugar absorption. Avoid pairing them with your meds, especially in the morning. And always read medication labels, some even warn against citrus. Coming up next, we'll dive into a fruit that's often praised for its digestive benefits but can become risky in ways few people understand. You might be using it after meals without thinking twice, but in certain cases, it could set the stage for inflammation, spikes in acid, or worse. Let's uncover that in the next section. We just uncovered how oranges, particularly orange juice, can quietly interfere with your medications, even if you're eating well and following doctor's orders. But that wasn't just theory. I've seen it firsthand in my practice, and the story of Mr. Albert Bryant makes it all too real. Mr. Bryant is 79 years old, a retired bus driver from Georgia. Every morning, without fail, he had a glass of fresh squeezed orange juice with breakfast. He called it his sunshine in a glass. That small ritual brought him joy, especially as he took his heart and cholesterol meds alongside it. But after a few months, strange things started happening. He began feeling dizzy when standing up, sometimes a little foggy, forgetting small things. Then one morning, as he rose from his recliner, his knees gave out. He collapsed on the floor. At the hospital, scans confirmed a minor ischemic stroke. But here's what shocked everyone. His blood levels of medication were dangerously elevated despite no changes to his prescriptions. The problem? The citrus in his orange juice. Citrus compounds, particularly furanocoumarins, had slowed down his liver enzymes, preventing his body from properly breaking down his medications. Over time, the drugs built up quietly until his system was overloaded. His orange juice habit had turned from helpful to harmful. I'm Dr. Nana, and this is why I caution all my older patients. If you're taking statins, calcium channel blockers, or blood thinners, limit your intake of orange juice, or skip it altogether. Never mix citrus with your morning medications, especially without talking to your doctor. And if you still enjoy citrus flavor, try a splash of lemon or lime in water. It's much safer and has far fewer interactions. Because at this stage in life, even small habits like what you drink with breakfast can quietly shift the balance inside your body. And if that made you rethink your morning routine, wait until we talk about mangoes. Sweet, tropical, soft, and juicy mango feels like a little vacation on your plate. It's one of those fruits that seems too delicious to be dangerous. But if you're over 60, especially if you're on medications for blood pressure, heart rhythm, or cholesterol, mango could be quietly working against you. Let's break it down. Mango is one of the highest sugar fruits you'll find in the produce aisle. Just 1 cup of ripe mango packs nearly 45 grams of natural sugar. That's more than you'd get from a glazed donut. Now picture what that sugar does in an older body. As we age, our insulin response slows down. Our blood vessels become more fragile. A sugar surge like that doesn't just give you energy, it creates inflammation. Especially in the small arteries that feed the brain, where even microscopic damage can have major consequences. That inflammation can cause tiny cracks in the vessel walls. And when your body senses a crack, it forms a clot to seal it. That clot, in a healthy young artery, usually dissolves without issue. But in an older adult, especially one with narrowed or stiffened arteries, that small clot can block blood flow to a part of the brain. The result? A stroke. And the concerns don't stop with sugar. Mango also contains a lesser-known plant compound called mangifrin. Sounds like something harmless, right? But mangifrin affects your liver's enzyme system specifically, the same system your body uses to process medications. That includes a long list of common drugs, everything from statins to beta blockers to blood thinners. If you regularly eat mango while taking these medications, your liver may struggle to clear the drugs properly. That means the medicine builds up. Not because the dosage is wrong, but because your body can't metabolize it fast enough. And that's when side effects begin to show up: muscle aches, dizziness, fatigue, confusion, sometimes even an increased stroke risk. It becomes a double threat: sugar that inflames your arteries, and a compound that slows your body's drug metabolism. This doesn't mean you have to ban mango from your life forever, but it does mean you need to respect the timing, quantity, and your own health profile. Here's what I tell patients at Senior Health Boost: limit mango to small portions, a few slices, not a whole cup. Never eat mango on an empty stomach, especially if you're taking medication soon after. Avoid pairing it with medication times, especially those that rely on liver enzymes to break down. And always talk to your doctor or pharmacist if mango is a regular part of your diet and you're on medication. Let's be clear, mango isn't poison. But after 60, it's not just about what's healthy. It's about what's appropriate for your body now. And here's one more thing to remember. Most of the effects we've talked about, sugar spikes, enzyme interference, inflammation, don't show symptoms right away. They work slowly, silently, in the background, until one day, there's a fall, a fog, or a frightening trip to the ER. That's why education like this matters. Up next, we're going to talk about another fruit that seems like a safe staple used in pies, smoothies, and even jams. But for older adults, it may be doing something unexpected to your digestive tract and circulation, especially when eaten regularly. By now, you've seen how seemingly harmless fruits, bananas, grapes, pineapple, watermelon, oranges, and mango can take on a different role as we age. At first, the changes are silent. No symptoms, no warnings. But then one morning, you wake up feeling dizzy. You feel off balance. Your heartbeat flutters, or your blood pressure crashes unexpectedly. That's when the silence becomes something more serious. Let me tell you one last story, one that brings all these lessons home. Mr. William Booker, 83 years old, was a retired firefighter living in Nevada. He'd spent his life running into burning buildings, saving lives, staying strong. And when he retired, he wanted to stay healthy. He cut out sweets, stopped buying cookies. Instead, every afternoon, he'd treat himself to a few slices of dried mango. It felt like the smart choice: clean, natural, nutritious. He was also managing atrial fibrillation and high blood pressure with prescription medications. His heart doctor praised his efforts to eat better. But after a few weeks of this healthy habit, William began waking up lightheaded. He brushed it off. Probably just getting older, he thought. Then one morning, as he swung his legs out of bed, his body gave out. He collapsed. His wife rushed to his side and immediately noticed something was wrong. His face was drooping on one side. His speech was slurred. At the hospital, scans confirmed a mild ischemic stroke. Thankfully, it was caught early. But when the doctors reviewed his labs, something didn't add up. His medication levels were unusually high, far above what they should have been based on his prescribed dose. The cause? His liver was no longer metabolizing the medications effectively, and the culprit was hiding in his pantry, daily dried mango. You see, dried mango isn't just fruit, it's fruit concentrated. It has even more sugar, and even more mangifrin, the compound that interferes with your liver's ability to process medications through the cytochrome P450 enzyme system. In William's case, his medications for heart rhythm and blood pressure began to build up, quietly and dangerously, until the balance tipped. So here's what I, Dr. Nana, want every senior to remember. If you love mango, keep it small, just a few bites. Eat it earlier in the day, when your metabolism is stronger. Never eat mango at night, and especially not dried mango, it's far more concentrated. And always pair fruit with protein or healthy fat, like a handful of nuts, a slice of cheese, or plain yogurt. This helps blunt the sugar spike and supports steady blood flow. Most importantly, talk to your doctor or pharmacist if you're on medications, especially for heart rhythm, blood pressure, or cholesterol. Now, you might be thinking, after everything I've learned today, what fruits are actually safe for me? Or maybe you're feeling unsure about what to eat at all. That's completely okay. Awareness is power. Just by watching this video, you've taken a powerful step toward protecting your brain, your heart, and your independence for years to come. Because here's the truth. As we age, even our healthiest habits deserve a second look. The fruits that once supported us can quietly work against us, not because they're bad, but because our bodies change. Our kidneys slow down. Our liver filters differently. Our blood vessels become more delicate, and the medications we rely on can interact with even the simplest foods in unexpected ways. This video isn't about fear, it's about freedom through knowledge. You don't have to give up fruit, but you do need to eat it wisely. Choose smaller portions, eat earlier in the day, always pair fruit with healthy fat or protein, and most importantly, pay attention to how your body feels. Did you wake up with a dry mouth? Do you feel unsteady after a sweet snack? Did your energy dip after a fruit smoothie? These are not small things. They're your body's early warning signs, whispers that something might be off. And it's never too late to listen. Because you, the senior community we serve at Senior Health Boost, are the generation that's lived through it all. Wars, recessions, family, triumph, change. You've raised children. You've built careers. You've overcome. And now, you deserve clarity about what supports your health and what quietly harms it. So, as we wrap up this video, I want to leave you with this. Don't be afraid of your food. Be curious about it. Learn, adjust, protect yourself. Because your brain matters. Your heart matters. And the choices you make today could mean the difference between a healthy morning walk or an unexpected trip to the ER. If you found this video helpful, if it made you rethink what's on your plate, even just a little, then here's how you can help yourself and others. Hit the like button so YouTube knows this content matters. Subscribe to Senior Health Boost for more science-backed, senior-friendly advice presented clearly, calmly, and with your health in mind. And drop a comment below with the word aware to let us know you're not just watching, you're taking action. Because when you like, subscribe, and comment, you're not just supporting this channel. You're helping more seniors across the country discover life-saving information. And one last reminder, you've made it this far in life with strength, courage, and wisdom. Now is the time to eat smart and age stronger. Thank you for watching. I'm Dr. Nana, and I'll see you in the next video on Senior Health Boost. Until then, stay aware, stay strong, and take care of that incredible body of yours.